Hi all, the presentation now is going to be on embryology and anatomy of salivary gland. Introduction: salivary gland are a group of compound exocrine glands secreting saliva. The parenchymal element are derived from the oral epithelium and consist of terminal secretory units leading into ducts that eventually opens into the oral cavity. The connective tissue forms a capsule around the gland and extend into dividing groups of secretory unit and ducts into lobes and lobules. The basic structure of the salivary gland are compound glands as they have more than one tubule entering the main duct. The architectural arrangement is tubular acinar, where acinar are secretory units. The tubular acinar units are merocrine. Embryology of salivary gland. Salivary gland arises from the ectoderm of the oral cavity and are comparable to other ectodermal derivatives such as the sebaceous and mammary gland. The minor salivary glands arises from the oral ectoderm and nasopharyngeal ectoderm. They develop after the major salivary glands. During fetal life, each salivary gland is formed at a specific location in the oral cavity through the growth of a bud of a oral epithelium into the underlying mesenchyme. The parotid and the submandibular gland appears in the 6th week, the sublingual gland after the 7th to 8th week of fetal life. The minor salivary glands develops during the 3rd month. These are the stages of salivary gland development. First, the pre-bud stage, initial budding stage, early pseudoglandular stage, then the late pseudoglandular stage, canacular stage, the early terminal stage, and finally the late terminal stage. The epithelial bud grows into the extensively branched system of cord of cells. The excretory portion develops later than the ductal system. The primordium of the salivary gland is divided into pregland and preduct cells. The pregland cells takes part in the formation of acini, whereas the preduct cells are again divided into anterior and posterior domain. This gives rise to the common and individual duct respectively. Stage 1, which is the bud formation. It develops as proliferation of oral epithelium into underlying ectomesenchyme. A thin basal lamina separates the bud from the underlying mesenchyme. Interaction of the epithelium with underlying condensing mesenchyme associated with salivary gland provide optimum environment for the gland formation. Stage 2, which is the formation of growth of epithelial cord. Proliferation of the epithelial bud into the underlying mesenchyme, resulting in long epithelial cords. The mesenchyme around the developing glandular epithelium also proliferate. Basal lamina is believed to play a role in influencing the morphogenesis and differentiation of salivary gland. The stage 3, which is the initiation of branching in terminal parts of epithelial cord. Epithelial cord proliferation and its end branch into bulb. Stage 5, which is the branching of epithelial cord and lobule formation. Terminal end branches extensively formation numerous bulb or cleft formation. Connective tissue component below epithelial cord forms capsules and surrounds entire gland. Stage 5, which is called as a canalization. Lumen formation takes place at distal ends of the cord, then in proximal and at last in the central part. Lumen formation within the duct before they develop within the terminal bud. Apoptosis of centrally located cells. Different state of proliferation of the outer and inner layer of the epithelial cord. Secretion of fluid by ductal cells, which increases the hydrostatus. Stage 6, which is the cytodifferentiation. Following lumen formation in the terminal bud, epithelium consists of 2 layers of cells. Inner cell differentiation into mucous or serous cells depending upon the type of specific gland. Some of the outer cells of the epithelium differentiate into myoepithelial cells that are present around the secretory end piece and intercalated ducts. Portion of epithelial bud close to the oral cavity forms the main excretory duct. Distal portion forms the secretory end piece. The contractile myoepithelial cells which develops each acinus as well as the portion of the ductal system are derived from the neural crust cells and thus are ectodermal in origin. They become active between the 24th and 35th week of the prenatal development. It is important to note that most of the mesenchymal elements like the septa and the capsule are produced by the influence of the neural crust cells. The structure of the salivary gland. The basic functional unit of the salivary gland is the terminal secretory unit called as the acini. The terminal secretory unit, irrespective of the size and location, is made up of epithelial secretory cells, namely serous and mucus. The serous and mucus, along with myoepithelial cells, are arranged in acinas or acini with a rough spherical or tubular shape and a central lumen. The myoepithelial cells are located on the surface of the acini. The ductal system. The main excretory duct opens into the oral cavity. Excretory ducts are located in the interlobular connective tissue, and striated ducts are the main interlobular and ductal component. Intercalated ducts vary in length and connects the secretory endpiece with striated ducts. Intercellular canaliculi are extensions of the lumen of the endpiece between the adjacent secretory cells that serves to increase the luminal surface area available for secretion. These are the histopathological images of acini cell, serous acini, mucous acini, and mixed acini. Now, going into the classification of the salivary gland. The salivary gland is basically classified based on location as major and minor salivary gland, and based on the histochemical nature of secretory product, they are divided into serous secreting salivary gland and mucous secreting salivary gland. The major salivary gland, the largest of the salivary gland, 3 bilayer paired major salivary glands. They are located extraorally and their secretion reach the mouth by variable long ducts. The major salivary glands are the parotid gland, submandibular gland, and sublingual gland. The blood supply to the salivary glands. Since the salivary secretion is predominantly 90% water, it necessitates an extensive blood supply. The duct to the level of their interlobular striated ducts are supplied with a dense capillary network. The intercalated ducts and terminal secretory units are less extensive. Anterior venous communications are seen around the large interlobular ducts. The extensive capillary flexes originate from the separate anterior that exist around the excretory duct. The endothelium of the capillaries and postcapillary venules are fenestrated. The venous return follows the arterial supply. In the arteriovenous anastomosis, when the blood flow increases during the increased secretion, more blood is derived through the anastomosis, resulting in increased venous and capillary pressure. Therefore, increases the fluid filtration rate across the capillary endothelium, which takes care of the fluid necessary for maintaining the secretion. Going into the parotid gland, it is the largest or major largest of the major salivary gland. Its superficial portion is located subcutaneously, lying in front of the external ear, and its deeper portion lies behind the ramus of the mandible, filling the retromandibular fossa. The main excretory duct, that is the Stenson's duct, the duct measures 4 to 6 centimeters in length and 5 millimeters in diameter. Parotid gland is enclosed in well-defined connective tissue capsule, which sends septa into the gland, separating it into lobes and lobules. The blood supply for the parotid gland is from the branches of the external carotid artery as they pass through the gland. The nerve supply, the parasympathetic nerve supply, is derived mainly from the 9th cranial nerve, reaching the gland via the optic ganglion and the auricular temporal nerve. The sympathetic innervation of the salivary gland is provided by the postganglionic fibers from the superior cervical ganglion and reaches the individual gland in association with their vascular supply. The lymphatic drainage is via a paraparotid and intraparotid lymph node into the superficial and deep cervical lymph nodes. Going to the submandibular gland, it is the second largest salivary gland. The submandibular gland is one of the medial aspect of the body of the mandible in the submandibular triangle. It is placed posterior and superficial to the mylohyoid muscle. The main excretory duct, it's a Watson's duct, runs forward above the mylohyoid muscle, lying below the mucosa of the floor of the mouth in its terminal portion. It opens at the sublingual papilla and also called the carunculus sublingualis, lateral to the lingual frenum. The blood supply is from the lingual and the facial artery. Nerve supply, the parasympathetic innervation is derived primarily from the 7th cranial nerve, reaching the gland through the lingual nerve after surfacing in the submandibular ganglion. The lymphatic drainage is the deep cervical and jugular chain of nodes. The sublingual gland, the smallest of the major salivary gland, which is almost shaped. The sublingual gland lies between the floor of the mouth, below the mucosa, and above the mylohyoid muscle. It is composed of one main gland, with several small glands. Main duct, the Bartholini's duct, opens with or near the submandibular duct. Several small ducts of Reynolds, open independently along the sublingual fold. The blood supply is from the sublingual and the submental arteries. Nerve supply, the parasympathetic nerve supply is also derived from the seventh cranial nerve. It reaches the gland via the lingual nerve after synapsing in the submandibular ganglia. The lymphatic drainage is to the submandibular lymph node. Going into the minor salivary glands, the minor salivary glands are located beneath the epithelium in almost all parts of the oral cavity. These glands usually consist of several small groups of secretory units opening via short ducts directly into the mouth. They lack a distinct capsule, instead mixing with the connective tissue of the submucosa or muscle fibers of the tongue and cheek. There are 600 to 1000 minor salivary glands lying in the oral cavity and oropharynx. The minor salivary glands are classified according to their anatomic location, that is, labial glands, buccal glands, lingual glands, palatine gland, glossopalatine glands, etc. They are not present in the gingiva and anterior raphe region of the hard palate or the anterior two-thirds of the dorsum of the tongue. The labial and the buccal glands. These glands of the lip and cheek classically have been described as mixed, consisting mucous tubule with serous demulins. However, ultrastructural studies of the labial glands have revealed the presence of mucous cells only. Glossopalatine gland. These glossopalatine glands are pure mucous glands. They are principally localized to the region of the isthmus in the glossopalatine fold. Palatine gland. These palatine glands are also the pure mucous variety. They consist of several hundred glandular aggregates in the lamina propria of the posterior lateral region of the hard palate and in the submucosa of the soft palate and uvula. Lingual gland. The lingual glands of the tongue can be divided into several groups. The anterior lingual gland are located near the apex of the tongue. The anterior region of the gland are chiefly mucous in character, whereas the posterior portion are mixed. Ducts open into the ventral surface of the tongue near the lingual frenum. Von Ebner gland. Of all the minor salivary glands, the posterior lingual serous gland, which is the von Ebner gland, are almost the most interesting. Their ducts open into the trough of the velate papillae and are rudimentary foliate papillae on the sides of the tongue. Classically, their secretion has been described as serving to wash out to the papillae and ready to taste receptors for new stimulus. Although this may be a part of their function, studies suggest that these glands have significant protective and digestive function. The major difference between the minor and the major salivary glands are the size of the minor salivary gland is large, whereas for the minor salivary gland it's small. The number, major salivary glands 3 in number, whereas minor salivary glands they are numerous, around 600 to 1000 in the oral cavity. The occurrence, major salivary glands are mostly bilateral, whereas minor salivary glands are diffuse. The location, major salivary glands are located extraoral with the duct opening intraorally, whereas minor salivary glands are intraoral. Contribution of whole saliva. Major salivary glands contribute about 90 to 95% of saliva, whereas minor salivary glands contribute 5 to 10% of the secretion. For a major salivary gland, a capsule is present, whereas it is absent for a minor salivary gland. The excretory duct, there is a single main excretory duct for the major salivary gland and there are multiple excretory ducts for the minor salivary gland. The secretion for major salivary gland mostly mixed except parotid, which is purely serous, whereas minor salivary gland it is mucus or mixed except for the von Ebner gland, which is serous. The viscosity of the secretion, it is thin and watery for the major salivary glands and thick and mucus for the minor salivary glands. The secretion content, it is rich in enzyme, mucus and proteins for a major salivary gland, and proteins are for a minor salivary gland. Protein important role in innate immunity suggested. Thank you.